Hi, everybody. I'm Nick Kman. I'm an emergency physician at The Ohio State University Wexner Medical Center and also a disaster responder with Ohio Task Force 1, the state's urban search and rescue team. I've been doing a little series of video blogs for the Columbus Medical Association. And recently, with our kids going back to school this week, I've been asked a lot about what I think about the Delta variant, how things are going with the pandemic, and what are my thoughts about returning back to school. So we decided to put together this little video blog for you all to listen to and hopefully provide you with some knowledge to make some good decisions as we enter the fall here. So about this video blog, hopefully online you can find the first back to school video blog I did actually, I think it was this week last year. And in that video, we talked a lot about masks and distance and community spread and how that would look like in the schools. And I didn't repeat any of that information in this blog. Actually, the methods that we have to keep our kids safe in school are pretty much the same. And they include, good hygiene and watching what's going on in the community and masking. And so those are all in the prior talk. I included a lot of evidence in this. So I really try to dig into the medical literature as much as I can. So I'll reflect on that a little bit. These are my thoughts about, entering the fall. So each parent is going to kind of have, and each doctor will have their own decision on what to do with the pandemic. And again, these are my thoughts. They're formed by my experience working in the emergency department and, what we are seeing each day that's new coming out of the medical literature. So one of the things that I think I'd like to start with is just how the state of Ohio looks, and especially our region. So if you look at the middle of this slide, Region 4 is where Columbus is. This is, I live in Delaware County, but I practice medicine in Franklin County. And the numbers that we're seeing with coronavirus really has to do a lot with where you live, because vaccination rates vary so wildly throughout the state. Our zone is zone 2, so I'll reflect on zone 2 because that's where Columbus is. But your zone may be different. But what we are seeing is a pretty sharp increase in cases within our zone. And that zone is made up of 3 different regions. And really, the regions in the southeast of the state, so the more rural areas of Ohio, are seeing higher spikes, Region 8 especially, in comparison to Region 4. So with that map in mind, it's unfortunate that I have to tell you that our COVID patient census within the inpatient hospitals of zone 3 of our zone 2, is the highest it's been since February 12th. And if you take your mind back to where vaccines were at that point, we had just started vaccinating like the 80 and over population. So not a lot of people would have gotten a vaccine in that amount of time. And I think what's a little bit scarier is the change in hospitalizations hasn't been this high since the week before we got the vaccine. So the vaccines arrived in the state on December 14th. The week before that, we had seen a sharp spike. And our censuses are all higher than they've been really than most points in the pandemic. And what's scary, and I'm sure you guys have all heard this, in the state of Texas is out of ICU beds. Our ICU census is at the highest point it's been since February, and the ventilator census is at the highest point it's been. But again, if you look at the percentages on the board, the real concern here is how quickly that peak is rising and where are we going to be in the next couple weeks. Region 8, which again, Southeast Ohio, has an 87% increase over the last 7 days. So, I hate to be, the bearer of bad news, and we'll certainly have some good news in this video blog. But right now, the trends are that we're back in the middle of this thing and kind of real busy on the healthcare front. This is what the trends look like. So All of us, I think, breathed a sigh of relief and took our masks off right here around June 14th when the numbers were really low. But if you look at the trend, again, we're back up to where we were in the spring with a trend of that number going up and up and up. And as far as why we're in this, the patients that we're seeing in the emergency department and in the hospital, by and large, are unvaccinated. So depending on what resource you look at, about 95% of the patients that are getting hospitalized are unvaccinated. And if you look at the map, you can see, why that's the case. So the really light county in the middle of the state is Holmes County, and they're only about 16% vaccinated. The darkest county in the center of the state, again, is where I live, is Delaware County, is about 66% vaccinated. Now, I mentioned that there is some good news when it comes to the pandemic. One of the things that I see as good news is if you look at the demographics of the people that have been vaccinated, 80 and over is about 80% vaccinated. So 4 out of 5 Ohioans that are 80 and over are vaccinated. And if you look at the age group 70 to 74, almost, up to 87%. So, only about 1 in 8 of that age bracket is unvaccinated. And so I think the numbers that we're seeing in hospitalizations are from those groups, and often they're from younger demographics. So, my age bracket, which would be 40 to 49, we're only about 56% vaccinated. So there's some good news on this slide in that a lot of our elders and a lot of our most vulnerable have been vaccinated, but there's bad news here because in Ohio, only about 59% of ages 12 and up have gotten vaccine. So we still have work to do for sure. There's a lot of people that kind of doubt the efficacy of vaccines. And I like this slide as a way to show how effective these are. If you look in the right corner here, weekly patient admissions by age group. And there's a little arrow under each time we released a new age group. So the first arrow on here was the week of December 14th. That's when we first got vaccines. And that week already there was a decline in people being hospitalized. That's because nursing home patients got vaccine. And then the next arrow here is the age 80 and up. And again, this graph starts to decline. And with each arrow is another age group that was released for vaccine. And you can tell what an incredible impact it made. But then you could start it seeing creeping back up because by then we had vaccine and it was really just up to people to get it. And this is where we see a lot of vaccine hesitancy. So for any doubt, all you have to do is look at weekly hospital admissions by age group, and you can see when they got vaccine, when people started to take it, and a pretty clear decline in the number of patients getting admitted. So like I said, this is a slide from the last video blog from last year, August 19th. These are the same things we have to keep each other safe in schools. We still have masks. If you work in the clinical setting, you wear eye protection as well. We're washing our hands. We're monitoring symptoms. We're not showing up to work sick or to school sick or kids sick with a fever or sore throat. Cleaning, disinfecting, we're using usually 3 feet of physical distancing within schools. And it's unfortunate that we don't have a whole lot more, but we don't. And I'm not going to talk a lot about COVID-19 treatment because not a whole lot's different there either. What we do have is prevention. And again, that's why it's so important that we talk about the vaccine. So I was at a family reunion outdoors on Saturday. We always have to specify that it was outdoors. But a lot of people were asking me about the Delta variant. Do we need to care about it? Unfortunately, we do. It's the most contagious version of the coronavirus. It spreads 2 to 3 times faster than the original virus. It grows more rapidly. So on average, people infected with Delta have about 1,000 more copies of the virus in their respiratory tract than those with the original strain of the virus, 1,000 more. And that unfortunately includes some people who have been vaccinated who can carry the Delta variant. And it gets infectious in your body quicker than the original form of the virus. So 4 days as compared to 6 days. So a family member asked me on Saturday, well, how do you know it's Delta? I think this is overblown. Well, the CDC monitors the types of the different variants through the health departments. So whenever we do a PCR test at Ohio State, that PCR test goes to the Ohio Department of Health that does typing of the specimen. So if you look at the top left here, August 7th, you see that number B.1.1617.2. That's the Delta variant. And right now, you can see on the slide that that's 82% of what we're seeing. But hold on, not only is it 82%, but a subtype of the Delta variant is about 16%. So if you look at the top, the Alpha variant's only about 1% of what we're seeing. So even though the rapid test that you might get through your work or through CVS doesn't get typed for whether it's Alpha or Delta, we can gather enough surveillance information from the PCRs that we're running to know what the predominant type is. We don't need to check every test. And what I would say to the doctors and nurses and other medical professionals that are watching this is it probably doesn't matter clinically, right? At the bedside, somebody has COVID, I'm going to take care of them like they have COVID. So, if you want to argue, well, I don't believe in that this is all Delta, well, fine, but it is all COVID. And I think we're seeing that it's really spreading like wildfire. I think the proof is in the hospital admissions and the full ICUs and other things that we're seeing. So are the vaccines effective against Delta? This is an article that was out of Nature. So, we've gotten to this point in the pandemic where everyone wants to argue whether it's a reputable thing and whether I should believe it. Nature was the journal that published the original structure of DNA. So it tends to be thought of as pretty reputable. It has a huge impact factor. And, what they published there is an analysis from England. The Pfizer vaccine was 96% effective against hospitalization. And so we know that the vaccines are still effective against hospitalization and death when it comes to the Delta variant, but we are seeing that that people are potentially going to test positive even though they've been vaccinated. So some other data that came out shows that the vaccines are 88% effective against preventing symptoms, and vaccinated people are 25 times less likely to get admitted to the hospital with COVID. That's a pretty good number, 25 times less likely to get admitted. So these vaccines are still incredibly effective at keeping people from getting really sick and dying, and that's what we care about. This was out of the New England Journal of Medicine. Again, hopefully we can all agree that this is a really reputable journal. The one thing that I will say is this study looked at the Pfizer vaccine as compared to AstraZeneca. So we actually don't have AstraZeneca in the United States, but what it does show is that the Pfizer vaccine was very effective still against Delta. So as you can see under dose 2, because Pfizer has the second dose, it was 87% effective against the Alpha variant and 79% effective against Delta. So again, more evidence that the vaccines are very effective. Even the J&J, so Johnson & Johnson announced some preliminary data, and I always struggle with the preliminary data that's released from the drug company. So we have to look at that with kind of a slant eye, but what they showed is a very strong immune response, at least 8 months out against highly prevalent variants, and 77% effective against severe COVID. So I think, we need to keep a close eye on that. But this was also in the New England Journal of Medicine. Right now with the pandemic, as we've talked about in the past, we have to take all the data we can get. We have to analyze it and, take it for what it's worth. So getting a lot of questions, do I need a booster shot? The answer is yes. If you are one of the 3% of Americans who are immunocompromised, so if you've had a solid organ transplant, if you've been on chemotherapy, if you have an autoimmune disease, if you're on an immunosuppressive drug, the CDC and FDA have met, and the EUA for the vaccines have been extended to include a third shot in that group. And according to preliminary data, this produced a 5-fold increase in antibodies against Delta after the second dose, and then 11-fold in elders. So we know that people who are immunocompromised hardly get any response to the first shot, and they get a limited response to the second shot. And the thought is a third booster, finally, they're going to mount that immune response. Because, I can tell you anecdotally, the only patient that I've recently admitted with COVID that's been vaccinated was somebody who was a cancer patient on chemotherapy. Again, we're not seeing vaccinated patients coming to the ER with COVID because they just don't get that sick. But here's a little bit of bad news, and this is something that I'm watching pretty closely because I got a Pfizer vaccine first dose on December 15th and then a second dose on January 5th. And the Mayo Clinic looked at a lot of people that got vaccines between January and July. And the Moderna vaccine was 86% effective against COVID over the course of the study, and Pfizer was 76% effective. So that's great news. And both were very effective against admissions, ICU admissions, and deaths. Again, great news. But during the month of July in Minnesota, when the Delta variant became the predominant variant like it is here in Ohio, the effectiveness against COVID-19 infection for Pfizer dropped to 42%. So I think a lot of us in healthcare that got Pfizer are really kind of seeing, is this unique to Minnesota? This was a single site study. Does it translate to Ohio? And what's going to come out of that? I will say that the people that I talk to are not yet advocating for a booster shot for people who got Pfizer or Moderna, because the drug company, first of all, the literature shows that you're not going to get sick and die. And second of all, if there is a booster to be had from both of those, they're being studied against the Delta variant. So you wouldn't want to get a third booster of the same shot that doesn't work as well against the Delta variant when you could wait a little bit, get a booster that's more effective against the variants. So I think that's what we're watching in medicine. So right now, if you're one of the people that got an early vaccine series, stay tuned. This is always changing, but right now boosters are not recommended for us. And you shouldn't go out on the sly and say you haven't had a vaccine yet and go get a third dose somewhere, because it's just not recommended and probably not going to help a whole lot. I heard a lot of things. Well, I don't need to get the vaccine because I've already had COVID. Well, we know this is not true. So when you have natural infection, your body makes antibodies to different pieces of the virus, right? So if my body makes 100 copies of antibody, it might only make 50 to the spike protein, and the rest is to the capsid or other parts of the virus that changes, or it's not going to be a valuable immune response. And so this, the proof is in the pudding. So they looked at people in Kentucky who had tested positive for COVID and did not get vaccinated this year. And their rates of COVID reinfection were almost 2.5 times higher than those that got their vaccine, because they were infected last year with the Alpha variant. And now they have a kind of a subpar immune response. It's better than no immune response, but it's not as good as what you get out of a clean vaccine immune response. And people are getting reinfected. And as opposed to, almost double the people that got the vaccine after infection who didn't get reinfected. So if you've had the COVID, if you've gotten COVID previously, you should still get vaccinated because it's going to help you stay healthy. What about kids? So, the number of kids infected with COVID is soaring as we've seen kids going back to school. About 1,600 kids were hospitalized with COVID last week, which was a new 7-day record and a 27% increase over the week before. In the state of Tennessee, the state health commissioner says that they think their children's hospitals will be full by this week. I have a good colleague that works in Louisiana, and she texts me about how busy they are. They're drowning in COVID, and Arkansas's only children's hospital, the ICU beds are full. So um, it seems that, that there may be a predilection, or maybe this is just more contagious and we're seeing it in more kids. Maybe we're seeing more COVID in kids because we vaccinated so much of the other population. And this isn't, I'm not going to keep my kids in a bubble. They're going to go back to school and they'll wear masks and we'll do what we were doing pre-pandemic. But it is cause for concern, especially at least my kids go back to school this week. So it's something to think about for sure. So the American Academy of Pediatrics sent a letter out that more than 67,000 primary care pediatricians, medical subspecialists, and surgery specialists write to urge the FDA to work towards authorizing vaccines for kids. So my daughter turns 12 on Saturday. So she's excited to get a vaccine, and can, after a while, hopefully get rid of the mask because she'll be freshly vaccinated. But it's something to be concerned about. Again, this is just a review slide to show you that these vaccines are incredibly safe. Millions and millions of Americans have been vaccinated. Millions of Ohioans have been vaccinated. And as somebody who worked the vaccine site for a lot of the winter and spring, we see almost no adverse reactions. I mean, what we see is we're giving you a little bit of COVID so your body can mount an immune response. And so people feel like that second shot, they feel like what it feels like to have coronavirus. And then the next day it's gone and they're protected. Heard a lot of people say, I'm not going to get J&J because of the blood clots. Again, I think we struggle with assessing risk in this country. If you get COVID and you get hospitalized, you have a 1 in 5 chance of getting a blood clot. 1 in 5 hospitalized patients. You're 10 times more likely to be struck by lightning than to get the thrombocytopenia syndrome that we saw with J&J. It's almost unheard of how few case reports there were of this. So it just bears writing. If you're willing to go on a golf course, when you hear a rumble of thunder, you're 10 times more likely to be struck by lightning again. And I'm sure I could put a lot of other statistics up, like getting hit by a bus or bitten by a shark. This is so rare. It's just, next to unheard of. And again, the CDC came out with a very strong statement about if you're pregnant. If you're pregnant, you have a risk of being sick with COVID. And we've seen plenty of stories of women going on ventilators after giving birth because they were afraid to get the vaccine. The antibodies are passed on to the baby. So it's very safe. It doesn't cause infertility. Again, the vaccines are like giving you a small amount of COVID. So if the vaccine caused infertility, then getting COVID would cause infertility. It just doesn't, it's not intuitive, doesn't make sense. A vaccine goes in your muscle, your ribosomes make some spike proteins, you mount an immune response, and away you go. So community activity still matters. So this is where it comes back to masks. So, we thought we were out of the mask era. I think I did. We were, congregating without masks. I'm in my office today at the medical center, and we were walking in the hallways again without masks. But what we saw is that with the Delta variant being so contagious and people who are unvaccinated spreading COVID around, that it's probably in our best interest to go back to masks. So again, if your kids didn't go to school last year, my kids went back as soon as they could. We saw very few cases within schools. So we know they can do it. We know they can wear a mask. And so, I've had a discussion with my kids. They're going to go back to school with masks on. I think Caroline, she turns 12 on Saturday. 2 weeks after she gets her second vaccine, we'll have a discussion about, whether she still needs to wear the mask. But until then, my wife and I work in healthcare, and although we're vaccinated, I want to limit my exposure. get exposed at work all the time. So, if I can limit that, and same thing with my son, he'll be in a mask all year until the EUA comes out for, it'll probably be kids from 6 to 12. They probably won't do that big age range. But then, he'll get a vaccine and we'll be protected. So again, I did a case series last year about Georgia. So, and even, I guess, scarier thing happened in Mississippi. So in Mississippi, kids went back to school. There was no mask mandate. There was high community spread, no social distance, and a high incidence in the community. And the state of Mississippi just 2 days ago, or a week and a half ago or so, up to a couple days ago, had 69 outbreaks between August 2nd and the 6th, which was the second week of school. So that makes sense, right? The kids got a mix. It takes 4 days or so to manifest symptoms from the new Delta variant. So the timing is like perfect. And there were 1,000 children and 300 teachers that tested positive for COVID-19, according to a weekly report from Minnesota Department of Health. And so what happened is then they had to shut all the schools back down. And frankly, in the South, they don't have places to put patients. So, there's no ICU beds in the state of Texas. We know Missouri, Arkansas, Louisiana, Florida have huge problems with full hospitals. So I think, we have to be careful. And, I'm a disaster responder. So, last year I went to Hurricane Laura and our team went to the Surfside apartment collapse. And, it's in our thoughts as disaster responders that we need to go to respond to areas where there's just terrifyingly huge incidents of the Delta variant in the South. And so, I think the president and others have come out and said, hey, if you're in the South and you think you're going to have to evacuate secondary to a hurricane, you better get a vaccine because we don't know where you're going to evacuate to. You're going to be in a gymnasium somewhere with a bunch of other people and the hospitals are full and the hurricane's going to affect the infrastructure. So we got a problem here if we have a bunch of people displaced with COVID. So I want to kind of to end with this, and actually I think there's probably a full video blog on burnout, healthcare, and COVID-19, but I've seen a lot of these stories. About half of healthcare workers have reported burnout at some point in the pandemic. And, I felt like it was really great last year in March. People in New York City would come out and cheer for the healthcare workers. But now what we have is what I saw in the news yesterday, where people in Tennessee were threatening to follow doctors home to where they live and kill them or hurt them or kidnap them because they were testifying about the efficacy of what we have during the pandemic, like masks and vaccines. So, if I went to the Teachers Association, I said, I think we need to wear masks and someone threatens to kill me, that does contribute to burnout. We are seeing a lot of patients hospitalized with COVID. I think we did yeoman's work last year, and to see people, not prioritize the we. Disaster response is about us. It's not about me. It's about doing the greatest good for the greatest number. And there's just a lot of people who are selfish, and not doing the right thing. And I'm going to be honest with you, people are leaving medicine. We're seeing nurses leave, and it's just sad. So I don't want to end on a down note. So I'll end with a more positive note that vaccines are effective. We know they prevent hospitalizations and death, and they even do that with the Delta variant. At this time, a booster isn't recommended for doctors or nurses who were vaccinated a while back, but all those things are being studied. And the best ways to prevent COVID is to get vaccinated and avoid exposure to the virus. And, a lot of this depends on where you are, right? If you're traveling in the South, you're going to have a lot higher risk than, again, if you live, in a place with huge, Vermont, for example, has very high vaccination rates. There's going to be less COVID floating around. So what am I going to do? I'm going to vaccinate my children when the vaccine's approved for them. So again, one of them will be able to get vaccinated soon. The other one, maybe not so soon. I do have partners who have their children enrolled in vaccine trials, and and they're all really excited that their kids have a 2/3 chance of getting vaccine versus placebo. I'm going to mask them until they're fully vaccinated while they're at school. When we're outdoors, we don't mask, but indoors, we've certainly gone back to that. I'll get the booster when it's approved for my demographic. It's not yet. And also, I think I had a colleague I was talking to, said, why are we worried about getting people a third shot? We have to worry about people getting their first shot. And I think that makes a lot of sense. I support vaccine policies for healthcare workers. I'll be honest with you, we take an oath that says our first core ethic is to do no harm. And I take care of cancer patients, I take care of the elderly, I take care of people that are vulnerable. And I do think people who work in healthcare should be vaccinated. And, I think we know the science is strong. And so I was happy to see that Central Ohio did a great job of, working together to do that. And I'm going to comply with mask policies for schools, and I think that we know that worked last year in schools. I think a lot of the spread that entered schools was case traced to be a contact from sports or a family gathering or something that was actually outside of the school where everyone was masked. I also think the fact that the teachers got vaccine make this year much safer than next year. So those are my thoughts about the Delta variant and about going back to school. That one was a little longer, but there's a lot going on, and it's been a while since I talked to you guys. Please get a hold of me on social media, Twitter at Dr. Nick Kman. I'm on Facebook. You can get a hold of me through the medical center. And again, I want to thank the Columbus Medical Association for letting me talk to you for a while. Again, this data is changing really quickly. So if we see a big change in what's going on with Delta or vaccines, we'll come back and talk to you another time. But for now, that's it, and stay safe and get your vaccine.